You're watching CTOM TV. Knowledge is power.
Jose is wondering, Alex, are there any new treatments available for my liver cancer?
Yeah, okay. We haven't really spent a lot of time on liver cancer.
No, it's actually coming up in 2 weeks. We'll
Okay,
be doing
great,
a whole...
wonderful. Yes. So liver cancer. Liver is an interesting organ. It has some regeneration capabilities. It's a pretty important organ because the blood passes through it, and therefore it's usually the site of metastasis for a lot of cancers. And because it has this high content of stem cells and it has a certain level of regeneration, it's a perfect spot for metastasis. Cancer cells tend to grow very well in the liver tissue.
So are you suggesting if somebody says they have liver cancer, is that not a primary place as well?
When you have liver cancer, you're insinuating that is a primary.
Okay.
So that's what I'm assuming here.
Okay.
Now, there's different types of liver cancer, obviously, and it's important to understand which type, and it's also important to know which genetic features. So once again, sequencing, very important. So a couple of examples. There's one common type called hepatocellular carcinoma. And there's a good treatment combination with a drug called cabozantinib and the immune checkpoint inhibitors nivolumab and ipilimumab that were just previously discussed in George's question. There's another combination with a different PD-1 ligand inhibitor called atezolizumab, and that's combined with Avastin, which is a VEGF inhibitor that's been around for quite a while. So those seem to be two new ones that are getting good results in hepatocellular carcinoma.
And do I need to have my genetic testing to know?
Definitely.
Okay.
I mean, these are given in a general approach, but obviously they're going to work better in some people than others based on the genetics.
Sure.
And then you have cholangiocarcinomas and bile tract cancers. And there's intrahepatic and extrahepatic. So for intrahepatic, I believe ivosidenib, which is a targeter of IDH1, and that's a molecular feature that's common to certain types of brain cancers. So it was recently found to be a driver of intrahepatic cholangiocarcinoma, and they started using that drug on it, and it's getting very good results. There's another one called pemigatinib. That's an FGFR1, 2, and 3 inhibitor, and that seems to be a feature that's also common in intrahepatic cholangiocarcinomas. So it really depends on the type of liver cancer you're referring to and the molecular features. So obviously you want to know your molecular features before you start picking any treatments.
Right.
Very important.
So the answer, I guess, Jose, is yes.
Yes,
there are new treatments for liver cancer, but it's important to have more differentiation in your diagnosis. So
stratification.
Thank you. Proper terminology, stratification in your diagnosis, so that you know what treatments are going to be right.
Exactly. Yes.
Okay.
Thank you for watching CTOM TV. Subscribe below and stay informed.